Hi there, this is Sultan Al-Waji and this is a public health chunk. What does the new blood pressure guideline mean? It means that almost half of adults in the United States could now be classified as having high blood pressure after the guidelines from the American Heart Association and the American College of Cardiology. Last week, these two agencies released new guidelines for diagnosing blood pressure that will triple the number of men and double the number of women with high blood pressure in the US. On the other word, instead of having 72 millions with high blood pressure in the US, we will have about 100 millions. This labels another new 30 millions with high blood pressure. The new blood pressure cutoff is 130 over 80 millimeter of mercury instead of 140 over 90. Now nearly half of American adults and more than 80% of those who aged 65 years and above will find themselves need to decrease their blood pressure by diet, exercise, increasing their dose of medication, or by adding another antihypertensive medication. This leads to consequences like what the New York Times Post said: experts in geriatrics expect many more complications among older patients receiving more intense treatment, such as fall, dizziness, or dehydration. Dr. Steven Nissen from Cleveland Clinic said he's worried about treating blood pressure aggressively may cause trouble like falls due to faint. Another consequence is kidney damage. Although lowering blood pressure is good for the heart and brain, it is not usually good for kidney, and we expect more kidney damages with the new guideline. Even though we know the first step to reduce blood pressure is diet and exercise, but with the new recommendation we expect more people take drugs to reach the new goals. This is the first time in 14 years a panel redefines what's considered high blood pressure. The new guideline actually aimed to reduce complications of high blood pressure, such as heart, brain, kidney, and other organ damages. The guidelines came from a paper published in the New England Journal of Medicine in 2015 called SPRINT, the Systolic Blood Pressure Intervention Trial, which compares standard versus intense blood pressure control. But SPRINT signifies the importance of reducing systolic blood pressure to a lesser than 120 millimeter of mercury. So, are we going to see a lower blood pressure cutoff after a few years, something like toward 120 millimeter of mercury instead of 130? This is a question good to be raised. In summary, whether you have high blood pressure, borderline blood pressure, or normal blood pressure, diet, exercise, and reducing stress would definitely help your body reduce the blood pressure and protect your organ. Our healthcare is more focused toward sickness and medication, and it should pay attention more toward wellness and prevention. This was Sultan Al-Waji, and thank you.